Hi. So you have a 6-week-old baby who's been throwing up for the past few days, not keeping anything down, shooting out the formula or the milk, and has not been wetting diapers, and you are worried. So what could be going on? There are many reasons for a baby that age to be throwing up, and today I wanted to talk about one of the fairly uncommon ones called pyloric stenosis. So hi, I'm Dr. B, a board certified pediatrician and a pediatric critical care with a long experience in taking care of sick children. So what is pyloric stenosis? It is a thickening of the muscle it's at the junction between the stomach and the intestine. So there is a junction right there from where the milk will pass through from the stomach into the intestine. So there is a thickening of that muscle. So let's say normally your opening might be that big, so the milk passes through easily. However, when that muscle becomes really thick and tight, the opening becomes narrow. So it becomes like a really narrow tube. So anything that goes through is having some obstruction, and that leads to some backflow in the stomach, and that can make you vomit. So that is basically what pyloric stenosis is. It is something that the babies are born with. It's a congenital defect, and the reasons we don't know. It could be environmental, it could be hereditary, or it could be sometimes some babies, if they are treated with Zithromax in infancy, that can lead to pyloric stenosis. So now that we know what is pyloric stenosis, how does it present? So just like your baby presented. So the typical age is between 2 to 6 weeks, up to 12 weeks max. And it's more common in male babies, usually the firstborn. And how they present is exactly that, is excessive spitting up, and a lot of those vomits are usually projectile in nature, like that exorcist vomit. So they just tend to shoot it out. It might hit the wall, So projectile vomiting is number one. Number two, the vomit is never green. So if it's a green vomit, that's more worrisome, and you need to, think about other things. So it's always the milk or the formula that the baby has taken in. And as they keep throwing up and not keeping anything down, they can get dehydrated. So they might have less wet diapers, they are very fussy, they're not keeping anything down. So that's typically how a baby with pyloric stenosis would present. So if your baby is doing this, we need to make a diagnosis. And how would we make the diagnosis? Very simple. So you need to go to the hospital, and we would order a pyloric ultrasound. So that ultrasound is going to take a look at that pylorus and will make the diagnosis. Now, besides the ultrasound, we would also order some blood work. And why? Because these babies tend to get dehydrated, and then there are some electrolyte abnormalities which would need to be corrected. So some basic blood work and an ultrasound is all that is needed to make this diagnosis. So let's say the diagnosis is now made. Your baby has pyloric stenosis, you've been told. What are the next steps? So this child would need to be admitted to the pediatric floor. So we would be taking care of that baby on the floor. Number one, we would not let the baby eat until the surgery, because this child is going to vomit anyway. So number one is NPO. Number two, we would put this baby on some IV fluid. So we would need an IV access. We would put the baby on some IV fluid, and we would correct the electrolyte defects. We would correct the dehydration and get them all ready for surgery. And then number three, the ultimate treatment is surgery. It is done by a pediatric surgeon, and the procedure is done under laparoscopy. So it's not like a big surgery. And it's called pyloromyotomy. Essentially, they just loosen up that muscle, so they make the opening, going from very narrow to make it bigger. So that's essentially what is done. So once the surgery is done, the baby comes back to the pediatric floor, and we start feeding that baby a few hours after surgery, and we start slowly advancing. And the baby typically tolerates the milk very well, and once they are up to their full feeds, the baby can go home. So post-operative course is not very long. So they usually they're 1 to 2 days, depending on how well they are tolerating their milk, and then the baby goes home. There's usually, I have never seen any complications from this procedure in all this time. Now, obviously your surgeon will go over all the risks and things with you. However, it's fairly simple once the diagnosis is made. So the key take-home points is this. So if you have a 2 to 6 week old baby, typically a male baby, who's been throwing up a lot and maybe projectile vomiting, need to think about this pyloric stenosis, because it can get missed if you don't think about it, because there are other more common causes, obviously, of a baby spitting up. However, pyloric stenosis needs to be kept in mind. I hope that helps explain that. And if you find my content helpful, please subscribe to my channel. Thank you.